Hello. So I'm currently recording this session. So at least you yeah mo reference later. So sexual dysfunction, gender dysphoria, paraphilic disorder. So in general, this is what we call mga sexual disorders gid. And in DSM-5, these three are separated in their own categories. But in this lesson, so ano ko lang siya yung isa. Okay? So, it's, dati nga lang kung nakakilala niyo natin nga istudihan ang mga sexual dysfunctions, gender dysphoria, and paraphilic disorders. So, we know that sex is part of life. And it's when you become counselors man someday, diba? And if you want to become a marriage counselor, so part yun na iyasang topic or one of the problems man sa marriage is about the sex. So that's why as also if you want to become a future psychologist, counselor, or psychiatrist, it's better that you know what are the common sexual dysfunctions, gender dysphoria, paraphilic disorders, because this affects our not only the person's individual functioning but also ang ilang partner. Okay? Ga-affect na sa ila. Kumbaga social, emotional functioning man. So, let's start with sexual dysfunction. So, syempre though, ang sa sexual dysfunction, though, it's a mix of biological and also psychological mga reasons, but most of the time, di ba, ang mga sexual dysfunctions may be caused by too much stress, okay, or too much nga mga environmental factors man, base sa marriage nila mismo, may problem. Okay, so, yun. So, there are many factors that you can pinpoint kung anong ilang factors why they might have sexual dysfunctions, but what I'm going to present lang are the common ones. So, when we say sexual dysfunction, so this refers to a problem occurring during any phase of the sexual response cycle that prevents the individual or the couple from experiencing satisfaction from sexual activity. So, you remember the sexual response cycle, diba? What is the first phase? So, so it traditionally includes excitement, then plateau, then orgasm, and resolution. So, sexual dysfunctions, it refers gani kung any problems in their sex nila in either sa excitement phase or during the plateau phase or sa orgasm or even sa resolution nga phase. So, there is also a factor about the desire and arousal that are both part of the excitement phase of the sexual response. Okay, so since we are uniquely created, okay, so lain-lain man ang aton nga arousal and desire when it comes to sex. And like I said, that's why we want to get to know more about sexual dysfunctions, because if we have clients that are married or any couple man, so part yun na isang ilang relationship ang sex. So, what are some male sexual dysfunctions? So, in the DSM-5, these are the diagnostic criteria for sexual dysfunctions that are specific to biological males. Okay, so these are specific to biological males. Emphasis on that. So, firstly is delayed ejaculation. So, this is delayed, infrequent, or absent ejaculation in at least 75% of partnered sexual activity occasions. In the previous version of the DSM-4TR, this sexual dysfunction was referred to as male orgasmic disorder. So, delayed ejaculation again is delayed, infrequent, or absent ejaculation in at least 75% of partnered sexual activity occasions. So, next naman is erectile disorder. So, this is diagnosed when a male has 1. Difficulty getting erection. Number 2, difficulty maintaining an erection. Or 3, decrease in how rigid the erection is during 75 to 100% of sexual activity encounters. So that is the diagnostic criteria for that. Okay, so si erectile disorder, hindi lang din na siya sa difficulty in getting an erection, but also it could mean man also nga difficulty man siya mag-maintain sang erection or how rigid the erection is. So damo man causes ang erectile disorder besides the psychological side, 'di ba, biopsychosocial model. So pwede ang iban maybe cause, 'di ba, I think smoking could be a factor or something like that. So sa lifestyle man sang person in at least. So next is male hypoactive sexual desire disorder. So this is the lack or recurrent decrease in sexual thoughts, fantasies, and desires for sexual activity. It is the responsibility of the diagnosing clinician to determine that desire is not only perceived as low in comparison to the desire of one's partner, which would be a desire discrepancy between partners and may not be a sexual dysfunction. So, sa male hypoactive sexual disorder, so, kumaga wala siya desire gid to have sex, and either decrease or low ang iya sexual thoughts or fantasies and desire for sexual activity. Pero, of course, ang kailangan there is sa clinician, dapat i-determine niya ang what does it mean to have low nga low nga sexual desire. So it doesn't mean nga sa partner ya lang siya may low sexual desire, kundi with other cases pagid. Okay, so kailangan niya mag-benchmark, something like that. So next is premature or early ejaculation. So this is diagnosed when ejaculation occurs within 1 minute following vaginal penetration and before the person wishes it on at least 75% of partnered sexual activity occasions. So it is important to note that this diagnosis is applicable to men who engage in non-vaginal sexual activity, but unfortunately, the specific duration criteria remain unknown. Okay, so sa premature ejaculation, so it means that within 1 minute following vaginal penetration or before the person wishes to orgasm, which is also 75% of the time sang ilang sexual activity. Okay, so pero may ara man hindi lang na siya limited to vaginal penetration but also for non-vaginal sexual activity. So sa mga gay men man. Okay? So next naman is female sexual dysfunction. So this is naman more on sa female side. Okay, wait lang din. Sorry. So next, female sexual dysfunctions. So there are 3 sexual dysfunctions that are mentioned in the DSM-5, and these are specific to biological females. Again, so this 3 sexual dysfunction is in the DSM-5 specific to biological females. So first is the female orgasmic disorder. So this is a delay in or infrequency of or absence of orgasm or reduced intensity of orgasmic sensations during 75 to 100% of sexual activity encounters. So since there is lots of variations in the type or intensity of stimulation that triggers orgasms, clinicians are left to judge if a female's ability to orgasm is less than expected for her age, sexual experience, and stimulation receive. So, sa si female orgasmic disorder, so amo naman ni ang delay sa orgasm, infrequency sa orgasm, or absence of it. Okay? Or, so, kumbaga, ang benchmark nyo, or, for me nga, panumdum basta sexual dysfunction, so, most of the time, or 75 to 100% of the time during their sexual encounters. So, secondly, female sexual interest or arousal disorder. So, this is absent or reduced sexual interest or arousal. This is determined by meeting 3 or more of the following criteria. So, number 1, reduced or absent interest in sexual activity. Number 2, reduced or absent sexual thoughts or fantasies. Number 3, reduced or no initiations of sexual activity or not responding to partner initiations. Number 4, reduced or absent excitement or pleasure during 75 to 100% of sexual activity events. Number 5, reduced or absent interest or arousal in the context of any sexual cues. And number 6, reduced or absent genital or non-genital sensations during 75 to 100% of sexual activity events. So, amo na ang sa female sexual interest or arousal disorder. So, ang diagnosis ng female sexual interest or arousal disorder, it's a combination of the female hypoactive desire disorder and female arousal disorder from the DSM-4TR. So, ang una sa DSM-4TR, these are two separate disorder, but now in the DSM-5, so gin-isa lang nila. So, the next one is genitopelvic pain or penetration disorder. So, as constant or repetitive difficulties with, number 1, vaginal penetration during intercourse, number 2, vaginal or pelvic pain during penetration, or number 3, significant fear or anxiety about vaginal or pelvic pain, or number 4, tensing of pelvic floor muscles during penetration attempts. So, ang genitopelvic pain or penetration disorder, it's the combination of the diagnostic criteria of dyspareunia and vaginismus in the DSM-4TR. So, male genital pain has been removed from the current version of the DSM because of insufficient research, even though there is a growing evidence of men experiencing pain during erection, ejaculation, and receptive anal intercourse. So, tanan nyo lang, ang genitopelvic pain penetration disorder, it's a combination of dyspareunia and vaginismus. So, if you heard siguro, I think you've heard naman siguro of vaginismus, and I think the best chika or example of that is ang kay John Lloyd, to kag kay Shaina, something like that. Tama to ang issue regarding that. But if we consider, for example, the diagnosis, okay, it's now called genitopelvic pain or penetration disorder. So each of the sexual dysfunctions could be lifelong or present since becoming sexually active, or acquired, or meaning it developed over time, generalized or present in a variety of situations, or situational, or only present with certain simulation, situations, or partner. And clinicians could specify whether distress over symptoms is mild, moderate, or severe. So, note that not everyone agrees on the diagnostic criteria for all of these sexual dysfunctions. There's a variety of ways that people can experience a distressing sexual problem. And that being said, you might find yourself suffering from a sexual problem that doesn't quite meet the criteria above to be considered a sexual dysfunction. So, if you're distressed by this problem and or is negatively impacting your relationship, so you should go talk to a health professional, and they can still help you to point out to the right direction. So, amo gina ang why is it that we also need to study sexual dysfunctions, because of course it really affects the relationships of all man. Okay? So, if whether or not maybe someday you'll become sex therapists, so it's important you study this one. So, ay man gali. Nabasa ko na. Okay, so amo na ha. So, each one of us is different. Different sexual desires, different sexual experiences. So, amo man na nga it's still up to the clinician whether or not i-diagnose yung person with sexual dysfunction. Okay, so next is gender dysphoria. So, it's also formerly classified as gender identity disorder or GID in a previous version of the DSM. It is the formal diagnosis used by psychologists and physicians to describe people who experience significant dysphoria. Okay, keyword there, significant dysphoria or discontent with sex and gender that they were assigned at birth. So, many people who are diagnosed with gender dysphoria identify as transgender, gender fluid, or otherwise gender nonconforming in some way. However, not everyone who identifies as transgender or gender nonconforming experiences gender dysphoria. So, tandaan nyo ha, those who were diagnosed with gender dysphoria, they identify themselves as trans or non-binary or gender fluid, but nabutang man din nga not everyone who is transgender or non-binary or gender fluid has gender dysphoria. So, gender dysphoria is a controversial diagnosis characterized by a person's discontent with their sex and gender they were assigned at birth. So, symptoms of gender dysphoria in children include discomfort with their genitalia, feeling that they are different gender than the one they were assigned to, social isolation from their peers, anxiety, loneliness, and depression. Okay, so lain ang diagnostic criteria for children and lain man ang diagnostic criteria for adults. So, many transgender people and researchers supported the declassification of GID, arguing that the diagnosis pathologizes the natural form of gender variance, reinforces the binary model of gender, and can result in the stigmatization of transgender individuals. So, that's why isla nila from gender identity disorder to gender dysphoria. So, of course, there are advantages and disadvantages exist to classify gender dysphoria as a disorder. However, of course, many people argue that distress associated with gender dysphoria is not caused by any disorder within the individual, but by difficulties encountered from social disapproval of transgender identities and alternative genders. So, amo nang one of the issues gid. So, whether or not na anong mga causes ng gender dysphoria, is it within the individual bala or is it because of the environment? So, of course, there are people who are in the transgender movement and they have a different perspective of kung anong ilang what is the difference between sex and gender. Okay, so maybe wala pa ako kabasa sa DSM-5 ER kung anong changes na nabutang nila regarding gender dysphoria, but like I said man sa inyong sang last time, so maybe in the future basi kwaon na ni ang amo nga diagnosis or basi lainon ni man nila ang ngalan. So without the classification of gender dysphoria as a medical disorder, sex reassignment therapy may be viewed as a cosmetic treatment rather than a medically necessary treatment for many transgender individuals and thus may not be covered. So ang ano na di ang ilang stand dere is why is it that there is gender dysphoria in the DSM-5? It's because in some countries kailangan sang diagnosis before they can do sex reassignment surgery or therapy gani. So before sila i-transition from hormones pakadto sa ilang genitals. So kagdaan kung may diagnosis, at least may coverage sa insurance. But if wala, kung wala diagnosis, it would be viewed as cosmetic treatment gani, or do pares man bala nga nagpa-retoke ka sang imong nose or sang imong eyes, okay, so something like that. So amo ni ang diagnostic criteria for gender dysphoria in children. So it's a marked incongruence between one's experience or expressed gender and assigned gender of at least 6 months in duration as manifested by 6 of the following. So criterion A1, a strong desire to be the other gender or an insistence that one is the other gender or some alternative gender different from one's assigned gender. In boys, so which is the assigned gender, a strong preference for cross-dressing or simulating female attire, or in girls, a strong preference for wearing only typical masculine clothing and a strong resistance to wearing of typical female clothing. So, a strong preference for cross-gender roles in make-believe play or fantasy play, and a strong preference for toys, games, activities stereotypically used or engaged in by the other gender, and a strong preference for payments for the other gender. So, if you also notice man, medyo uh, vague man ang ilang diagnostic criteria, but may nabutang man sila 6 months in duration man. So, in boys, strong rejection of typically masculine toys, games, and activities, and strong avoidance of rough and tumble play. In girls, a strong rejection of typically feminine toys, games, and activities. So, 7, a strong dislike of one's sexual anatomy and a strong desire for the primary and or secondary sex characteristics that matches one's experienced gender. And B is condition is associated with distress, clinically significant distress, impairment in social, school, or other important areas of functioning. And there is also a specification whether or not with a disorder of sex development. So nagka-gender dysphoria siya because there is a biological disorder or organic disorder that is involved. So tong, for example, mga congenital androgenital disorder. So meaning from that time the baby was born, okay, may disorder na siya sa sex development. Okay, so something like that. So as you can see man, wala sang specific age in which na pwede naton makadiagnose ang gender dysphoria. So which is why though medyo pa siya controversial kay, like for example, what if the child expresses this pero when and then what if the therapist said na kailangan ipa-hormone na nga daan ang bata para pag-abot sa teenager niya, makapili na siya kung anong gusto niya. So, we know naman nga kung ano man ang matabo sa body naton, di ba? Kung ano man ginasulod, mga hormones and something like that. There is possible irreversible effects din na. So, this is also one of the issues with regards to gender dysphoria in children. So, ariman gani ang mga strong preference for toys, games, or activities that are stereotypically are with the other gender. So, what if gusto bisang bata ang mag-play sang na, but the kid doesn't have any distress man sa iyang gender. So, kasi adaan, it also lies man sa parents mismo. So, anong observation man sa parents and sometimes they disregard kung anong nafe-feel sa bata man mismo. So, there's a lot of issues with regards to gender dysphoria. So, ay naman for adolescents and adults, so syempre since adolescents and adults, so at least may sense of identity na di ang tao compare sa children, pa. So, a marked incongruence between one's experience or expressed gender and assigned gender of at least 6 months duration as manifested by 2 of the following. So, marked incongruence between one's experience or expressed gender and primary and or secondary sex characteristics. So, there's also a strong desire to be rid of primary and or secondary sex characteristics because of marked incongruence with one's experience between experience or expressed gender. So, for in other young adolescents, a desire to prevent the development of anticipated secondary sex characteristics. There's also a strong desire for primary and or secondary sex characteristics of the other gender. So, there's also a strong desire to be of the other gender, or some alternative gender different from one's assigned gender. There's also a very strong desire to be treated as the other gender, and a strong conviction that one has difficult feelings and reactions of other gender. And letter B, the condition is associated with clinically significant distress, impairment in social, occupational, or other important areas of functioning. So, as you can see, man gyapon, hindi lang sa individual mismo ginatanaw naton kung may gender dysphoria siya. So, we also try to look if there is really an impairment sa iya social or occupational nga side. So, meaning basta hindi siya kaskwela, so that he or she feels that he or she is not in the right body, something like that, or basta sa work niya, so extreme distress gani or impairment sa iyang socio-occupational function. So, may ara man specification if may ara siya disorder of sex development. That's why may gender dysphoria siya. Okay, so, now, last na lang, which is paraphilic disorders. Paraphilic disorders. So, paraphilic disorders comes from the Greek word para means around or besides, and philia, which is love. So, it is any emotional disorder characterized by sexually arousing fantasies, urges, or behaviors that are recurrent, intense, occur over a period of at least 6 months, and cause significant distress, or interfere with the sufferer's work or social functioning or other important areas of functioning. Okay? So, in the DSM-5, the term paraphilia is defined as any any intense and persistent sexual interest other than sexual interest in the genital stimulation or preparatory fondling with phenotypically normal, physiological, mature, consenting human partners. Okay, so paraphilic meaning may sexual interest ka other than the opposite sex or same sex or any nga do normal or phenotypically normal nga sexual desire. Okay, so next is paraphilias, however, may not be necessarily classified as intense and persistent, but rather preferential sexual interests or sexual interests that are greater than non-paraphilic sexual interests. Okay, so though more on mas preferred gid ang amo na nga thing, like for example, sa mga fetishes, so kumbaga hindi siya ka-function sexually if hindi na siya ma-fulfill ang amo na nga condition, something like that. So, there are different types of paraphilia. So I will describe them naman sa using the DSM-5. Okay. So, first is voyeurism. So, sa voyeurism, so it's watching an unsuspecting or non-consenting individual who is either nude, disrobing, or engaging in sexual activity. So, ano yung mga peeping Tom na mga people. So, they can't, pagkaka-arouse sila kung they watch someone. Okay? So, number 2 is exhibitionism. So, exposing one's own genital to an unsuspecting person. So, they usually do this in public because they get more aroused if they expose their genitals to people. Na unexpected. So, kung the more shocked the person is, the more aroused siya. Okay, so frotteurism naman, it's touching or rubbing against a non-consenting person. So, yung mga gaka-arouse sila kung they touch someone non-consenting, in a non-consenting way. So, usually, typical na sa mga places nga tutok, diba? Screens or sa mga elevators. So, they would try to touch or rub their genitals or their sexual body. Okay. So, next is sexual masochism. It's being humiliated, beaten, bound, or otherwise suffering. So, i-define ta pag ni further kung what does it mean nga kung sexual masochists agad kay naman with the rising trend of fetishes. So, kung anong borderline tabala kung mahambal ni nga do paraphilia na siya or paraphilic disorder na siya or just fetish lang gid siya. Okay, so next is sexual sadism. So, sexual sadism, so physical or emotional suffering of another person. Okay? Amo naman ang iyang. So, next is pedophilia. So, sexual activity with a child that is prepubescent, usually 13 years old or younger. Okay? So, next is fetishism. So, amo naman ni ang sexual fascination with non-living things or highly specific body parts or partialism. So, examples of specific fetishism include somnophilia. Meaning they are sexually aroused when someone is unconscious. Urophilia, so deriving sexual pleasure from seeing or thinking about urine or urinating. Okay, so unang examples later on may diagnostic criteria pa. Transvesticism, so cross-dressing that is sexually arousing and interferes with functioning. So naman they cannot function, they cannot perform sexually if they don't cross-dress. Okay, and next is autogynephilia. So it is a subtype of transvesticism that refers to specifically to men who become aroused by thinking or visualizing himself as a woman. So other specified paraphilia. So some paraphilias do not meet the full diagnostic criteria for a paraphilic disorder, but they may have uncontrolled sexual impulses that cause enough distress for the sufferer that they are recognized. So examples of such are paraphilias that include necrophilia. So, necrophilia meaning they get sexually aroused when they do it with a dead body or corpses. Scatologia, so, mga obscene phone calls, mga gatok dirty sa phone or any method. Proprophilia, feces and defecation, and zoophilia, animal. So, urges to engage in coercive or otherwise aggressive sex-like rape are not symptoms of mental illness, such as sexually offending, is therefore not considered paraphilia. So, let's now go to the diagnostic criteria of these different paraphilias. So, for voyeuristic, so over a period of at least 6 months, recurrent and intense sexual arousal from observing or in an unsuspecting person who is naked in the process of disrobing or engaging in sexual activity as manifested by fantasies, urges, and behaviors. So, this also individual has acted on these urges. Okay, so meaning, wala lang siya, it's not only in the thoughts, okay, but actions mismo. Okay, so they have already done this, okay, with a non-consenting person, or sexual urges or fantasies cause clinically significant distress or impairment. So, meaning hindi siya ka-function sa school or sa work niya, unless that he would act upon this sexual urges. And the individual experiencing the arousal and or acting on these urges is at least 18 years. Okay, so may criteria man, just dapat adult. And there is a specification whether this voyeuristic disorder is in a controlled environment. So, these are applicable to individuals living in an institutional or other setting where opportunities to engage in voyeuristic behavior are restricted. Okay, so next is exhibitionist. So again, at least 6 months, may intense sexual arousal from exposure of one's genital to unsuspecting persons. So, may mga fantasies, urges, or behavior siya. And of course, they must have acted on these sexual urges. And, or, grabe, may clinically significant distress siya or may impacted sa iya nga socio-occupational functioning. So, may ara specification whether ang tao nga na exhibitionist sa pre-pubertal children, so meaning that person gets aroused when he or she shows his or her genitals to children. So, sexually aroused by exposing genitals to mature individuals, and may ara man nga both. Okay? So for fraternistic, so of course, at least 6 months again. So, sexual arousal from touching or rubbing against a non-consenting person. So, and also the individual has acted upon these urges. Or, ang grabe ang distress nga cause sang amuni nga mga urges. Okay? And of course, specification niya if it is in a controlled environment. So, sexual masochism, so over a period of 6 months, recurrent and intense sexual arousal from the act of being humiliated, beaten, bound, or otherwise made to suffer, as manifested by fantasies, urges, or behaviors. So, these fantasies, sexual urges, or behaviors cause clinically significant distress or impairment in social, occupational, or other important areas of function. So, may ara, di ba, times na mabalaton. Kasi trip lang niyang mag-sexual masochism or sexual sadism. So, given man, di ba nga, muna ang ginapagawa sa media and all. So, nagiging disorder lang siya if, for example, hindi ka ka-sex normally without doing this things sa imo. Okay? So, may ara diri with astinxiophilia. So, meaning, if the individual engages in the practice of achieving sexual arousal is related to restriction of breathing. So, gaka-arouse siya kung the more mo siya nga i-choke. Yung mga choke me daddy, yung mga, mga ginawang hambal. So, hindi siya ka-function, hindi siya ka-perform sexually if wala siya gina-choke. Mas gaka-arouse siya the more nga gina-choke or ginakuga. In any way. Okay? So, it's also in a controlled environment. So, pwede na siya nga whether or not these individuals are living in institution or settings where opportunities to engage in masochistic sexual behaviors are restricted, and also if they are in full protection. Man, pedophilic disorder. So, again, at least 6 months, and they have fantasies, sexual urges, and behaviors regarding involving sexual activity with a child, or 13 years or younger. So, they have already acted on these urges. Or kung wala man, grabe-grabe ang ilang distress, and may ara sila interpersonal difficulty. And of course, ang age naton, the individual is at least 10 years, and ang iyang nga gina-target or ang iyang preferred partner is 5 years or at least 5 years older than the child siya or the children. Meaning, kung 16 siya, so minus 5, so mga niyang mga sexual partner na gusto. So, pedophilic disorder. So, next, galing ni, do not include an individual in late adolescence evolve in ongoing sexual relationship with a 12 or 13-year-old. So, kung pag ini ang contested man, kay like, when is the age of consent? So, I think, subong dugin pataas na from 12 to 16 na ata subong sa Philippines, which is unlike sa una, buday-buday gid niya i-determine, diba? Like, okay, when do we consider it as rape or pedophilia, obras, but, diba, kung age of consent is 12 or 13 years old. So, subong 16. So, pero na. So, for example, kung for example, kung near man lang ang age, like below 5 years man ang age of some kid, and they are already engaging in sexual activity. So, hindi na siya makonsider as pedophilic disorder. So, pero, amo na, some gray areas and some things na i-consider pa. Pero, so far, ang sa DSM-5 naton, at least, before natin ma-diagnose someone nga may pedophilic disorder, so, dapat at least 16 years siya. And, ang iyang preferred nga partner is at least 5 years younger sa okay, so either may ara nga exclusive type, so attracted only to children, media, and may ara man non-exclusive type. So, namdam pa gray areas when it comes to diagnosing sexual disorders. Lalo na nag-evolve man ang aton nga standards sa society. So, next is sexual sadism disorder. So, over a period of at least 6 months, okay, there's recurrent and intense sexual arousal from physical or psychological suffering of another person as manifested by fantasies, urges, or behavior. And the individual has already acted on these urges with a non-consenting person. So, pag yun na, non-consenting ang person. Or the sexual urges and fantasies cause clinically significant distress or impairment in social, occupational, or important areas of functioning. So, kung sa sexual masochism, so gusto isang person na siya ang ginasakit, kaka-arouse siya kung ginasakitan siya or gina-choke siya. Sa sexual sadism, gusto niya naman siya naman ang ga-inflicts pain. Kaka-arouse siya if he or she inflicts pain to a person. So, pero, ang kumbaga may ara man na factor kung whether or not ka-perform siya sexually, bisan wala sang amo na nga kakatabo, or if the person nga niya sang pain is non-consenting. So, may ara specification may gapon in a controlled environment or in full remission. So, may ara again, transvestic disorder. So, at least 6 months, may arousal, sexual arousal from cross-dressing, manifested by fantasies, urges, or behavior. So, these fantasies, sexual urges, or behaviors cause clinically significant distress or impairment in social, occupational, or other areas of functioning. So, with fetishism, so meaning the person is sexually aroused if by fabrics, materials, or garments, especially if one is wearing them. May man with autogynephilia if sexually aroused by thoughts or images of self as female. So, this is specific naman for men nga may transvestic disorder. So, may specification pagid if it's in a controlled environment or in full remission. So, fetishistic disorder. So, these are at least 6 months recurrent and intense sexual arousal from either use of non-living object, or a highly specific focus on non-genital body parts such as manifested by sexual fantasies, urges, and behaviors. So, they have these fantasies, urges, and behaviors cause clinically significant distress or impairment in social, occupational, or other important areas of functioning. So, fetish objects are not limited to articles of clothing used in cross-dressing, such as in transvestic disorder, or devices specifically designed for the purpose of tactile genital stimulation. For example, vibrators. So, hindi siya limited to only that. So, may ara specification whether may fetish siya sa body parts. So, anong example? Iba na gaka-arouse sila when they sa kilikili, something like that. So, pag yung mga weird nga madumduman ko sa fetishistic disorder. So, may mga gaka-arouse sila if they smell the kilikili or like grabe lang hindi siya preference though kilanlan gid na siya para maka-perform sila sexual. Okay? Sa ilang so non-living objects, so example ko tong sa ihi or corophilia tong about feces, or necrophilia which is all about dead bodies or other. So in a controlled environment. So that's it. I think that's it sa akong nga part sa tanan. So that's all for sexual dysfunctions and disorders. So, do you have any questions or gusto nga clarify about it? Also, don't besides sa may ara na ko gin record man, I can always review man to sa akon nga ginobra nga playlist. So, may sa YouTube nga hambal ko sa inyo. So, ang mga other disorders, kung wala man siya na record sa atong review classes, so, may ara man ko to nga na record ko naman sang previous ko nga class. Pakita ko lang sa inyo. So, just sa ako man to gyapon nga YouTube channel. So, may ara na kamo playlist ang mga disorders. So, sa diri sa playlist, tapos diri sa Psych 3102, so arin adi tanan. So, from definitions of normality, pakadto sa ah pakadto sa neurodevelopmental disorders. Kompleto. So, tanan nga na pang-mention naman. I think na include ko na din somatic symptom disorder and neurocognitive disorder. So, I think ang wala lang ko is ang kay Ma'am Jane to nga disorders when it comes to the behaviors in children and ang to mga eating disorders. Mo lang yun ang wala ko na record. But the rest here, you have your resources na for your review. So, I think I will, Miss Pao?
Hello.